Hi, my name is Angela. In this video, I'm going to be talking about why I am pursuing a PGY2 residency program in the ambulatory care setting, or why I love AmCare. So currently I'm in a ambulatory care track PGY1 program, but I did a video on why I really like academia and why that's like a pursuit of mine in my career, and this is going to be the AmCare side of things and why I really love that component of pharmacy. So some people don't know what ambulatory care is. They think ambulatory, they think ambulance, they think, oh, you're an ER pharmacist. No, that's an ED pharmacist. That's its own thing, its own PGY2 specialty. Ambulatory just means like walking or outpatient. People who are of the acuity level that they can be on the outpatient, and it's lower level acuity. It's, probably the lowest level when people are in the outpatient setting. Ideally, we want to keep them there. We don't want them going into the hospital in the inpatient setting. But I would just basically tell someone it's in between retail and hospital, although that may be overgeneralizing it. Your primary role usually is direct patient care. That's kind of like the core of what an ambulatory care pharmacist does. They're seeing patients very directly. Similar, community pharmacies do that as well, but you're doing the most of your work is focused on patient care directly. You typically would see less patients depending on the type of service you're providing. So one of the benefits ambulatory care pharmacists can have in these outpatient settings is doing a lot of pharmaceutical care or a lot of medication work for these complex patients who have a lot of needs that just can't be fit as well into other provider schedules. So as pharmacists, we're the medication experts, and so there's some problems that really we can handle very well, and with patients who have a lot of them or who are just very complex to begin with and need a little bit more time making their medication decisions, we are best suited to that, to save money, to make sure it's safe, and to make sure it's effective medication regimens. So if you think about a retail pharmacist, they see a lot of patients, but they're like low intensity services, like getting a vaccine, takes however many minutes, like 10 minutes. They're just asking quick medications questions. Hey, can I take this medication with this one? Or does this interact? Or does this over-the-counter medication treat this? You see a lot more, but you see them in shorter time periods and with less complicated questions and things. And especially if they know a lot of if pharmacists know a lot of their products out there, they kind of get more attuned and kind of can answer them even quicker. Same with an ambulatory care pharmacist, though. The type of clinic they're in or the type of patient population they see, they can usually be a little bit faster and really see those patients very effectively. So it could be a standalone clinic. It could be a clinic that the pharmacists are in associated with a health system. They really can do a lot of things because you see medications used just everywhere in almost every patient. So you can use the ambulatory care pharmacist in a lot of ways for a clinic, but really it depends on the clinic, it depends on the patient population that they're seeing, and it depends on what the clinic has in terms of tools, but then also gaps. Like they need someone to help with pharmacists, or they need transitions of care coordinator because they keep having a lot of safety issues or quality issues, and so a pharmacist can really help there. Or they just need someone to handle a lot of their complex diabetes patients and educating them on how to inject their insulin, check their glucose, adherence, stuff like that. Or they have really complex geriatric patients who have polypharmacy and are having a ton of drug interactions and are very tired of taking their meds, so they have lower adherence. Just the list goes on and on and on, but overall, the pharmacists are there to focus on meds, make sure it's safe, make sure it's appropriate, and save money, save time. So different models of how ambulatory care pharmacists work, I even have not the greatest understanding, so hopefully I'll learn that in PGY2 training, but sometimes pharmacists were not recognized as providers by the big Center for Medicaid and Medicare Services, CMS. So we can't bill directly and say, I saw this patient for this thing, boom, you can get reimbursed for that fee, or like fee for service. That's not how pharmacists are able to do it. Maybe in a couple states or maybe in a couple ways, they can do it directly like that. Otherwise, they have to bill under a physician. So I work with this physician and I did this, and so I can say I gave this service and that gets billed indirectly kind of. Or as a clinic as a whole, I work at this clinic and I did this service, so I can get money for that. Or you just, if they realize over time that the pharmacist or right up front that the pharmacist would improve quality, reduce cost, bring in reimbursement, bring in patients, they may salary the pharmacist and not really keep track of what services they're providing, or they might just maybe for research reasons or outcome reasons, or to maybe continually justify why the pharmacist should be there, why their services should be there. But a lot of ambulatory care pharmacists don't just service their clinics. They also are teachers, and they're involved in academic institutions, they may be adjunct professors and have dual roles at schools of pharmacy where they teach a few days a week, or they may take students on in rotations and do experiential ed. They may also be involved in research for their institutions, or their clinics, research in many different ways. They may be a part of state and local and national organizations and be on committees there or be involved in advocacy. There's just a ton of other things. Administratively, they could be involved with the health system and some of their roles. So ambulatory care pharmacists could have a lot different responsibilities than just direct patient care and servicing that clinic. So it really is very diverse, and it's very growing, it's really growing. So the job itself, if you think about the outpatient clinic settings, it depends on what the clinic is like, but usually you can expect to be working when the clinic is working, the hours and the needs, and then if you're involved in teaching academia, whatever hours those are at. But it really is a little bit different timeline, and some might say a little bit nicer timeline. You're at like that 8 to 5 or 9 to 5, and even sometimes the afternoons might be a little lighter, so you can kind of do more of your other work if you're involved in different roles. But that's just been my experience so far, is that usually mornings are pretty heavy with patient care, and then afternoons they try to schedule it where it's more teaching or it's more getting projects done, projects time. But if the clinic's not open on weekends or holidays, then you're not working on weekends and holidays unless you're on call. So that's a big perk, and that's honestly one of the things I really loved after working retail for so many years. I knew for the rest of my life I would love to not work weekends if I didn't have to, so going into residency training for this type of a career was very appealing to me. It pays well. I just kind of looked on a random website to see what an ambulatory care pharmacist made, and it said in between 75 and 201,000 with an average of 123. So I don't know how that changes, because how a pharmacist is paid is very dependent on what they're doing and who's paying them. So, TBD, if I finally figure that out in a better way, but it'll probably just be very variable, but that's just a range that I found to give an idea. And so the other thing to think about is that pharmacists are continually being recognized by state laws and organizations as providers and have a little bit more autonomy. So it really will just depend on what you do when you go to your individual state or your individual institution, what you will be responsible for and what kind of model you work under. So you may get to develop your own model as well if they just, have a couple examples but say, hey, you really can do what you want here. We need you to try and figure this out for us because we love an AmCare pharmacist, but we don't know how. That's something that PGY2 residency training will really hopefully teach me that PGY1 training just can't, because I have to build my clinical knowledge in all these other areas such as research and leadership and all these other things before I can get to that next step, which is more of the administrative side of what I would be doing in my job. So why do I think someone would enjoy this career? You just have so much direct patient care, and you get to deal with a lot of patients who need a lot of help, and that's really appealing to me. I think that so many parts of the healthcare system don't stop and do the good work of seeing what's going on with medications, teaching patients, and then really just optimizing them and making sure that things are on track. And a lot of pharmacists are very type A and perfectionists, so it can just be really good in the ambulatory or outpatient setting for someone to do that good work, save money, people can have better outcomes, all those things. So pharmacists are uniquely trained to do this, and I really like that service that they provide. So I think that I'm interested in a certain type of care, like preventative care and chronic disease state management, all those type of things, and I would see the most of that in the outpatient setting. So that's another thing that I would love about working in that kind of environment. I really do like educating patients, and so the community setting offers that, but the ambulatory care setting offers that even more. And I also have the opportunity to educate providers, or if I work in a clinic with medical residents, I have the opportunity to teach them in their residency. So it's really a unique opportunity to just teach a lot. And then you can additionally be kind of an academic role with it as well. And lastly, I feel like it's just a high variety job. I could go into the ambulatory care specialty, have variety within one job, but then also switch to another kind of model or setting or clinic or school or patient population. So I'm someone who doesn't like to get bored with my job, and I don't think I would be in the AmCare setting, so that's another thing that drew me to it. But I'm going to put a link below to a book I'm currently reading, which was recommended to me about ambulatory care for those of you who really want to know more. But hopefully this was helpful just to give you an idea of what it is if you didn't know anything about it. So go ahead and share the video if you think someone else is interested in AmCare or could learn more. Like it if you liked it, and then just go ahead and check in next week. Thanks.